Good morning and welcome to today's Coresight conversation. We are pleased to have two special guests from NACDS to talk for the tips of the trade or the future of the drugstore. And with that, I'm going to hand it over to Deborah Weinswig, our CEO and founder of Coresight Research.
And thank you everyone to joining us for tips from the trade. We are very excited to have NACDS's Jim Whitman and Steve Perlowski with us today. My name is Deborah Weinswig, and from a Coresight perspective, we have now hosted over 30 digital events this year. They're available in our digital events library at coresight.com/events. In addition, we also are featuring a great research report today on contactless payment options and how they are continuing to gain acceptance, obviously spurred by the current necessity. In terms of introductions, Jim Whitman I've known for many years and honored to call him a friend. He is the SVP of Member Programs and Services for NACDS. He has been with the association since 1977, joining as the first in-house legal counsel. He is currently responsible for NACDS's revenue generating initiatives and interaction between retailers and associate members. Steve Perlowski, who I also consider a great friend, has been with NACDS for over 30 years. He currently serves as the VP of Industry Affairs. Prior to NACDS, he held positions with both Eastman Kodak and BIC. So today we're going to discuss innovation in community pharmacy and healthcare delivery, innovation, customer behavior, and what the new normal might look like. Lastly, please use the Q&A function at the bottom of your screen during our conversation if you would like to ask questions, and we will launch and discuss poll questions during the call. So with that, Jim and Steve, let's start with the obvious question. How has NACDS helped to guide members during these interesting times, and how, what have you learned from that in terms of how you'll continue to interact with them, maybe in new ways going forward?
Well, first, Deborah, thank you for affording us the opportunity this morning, and appreciate all that you and Coresight's doing for the industry. It's very important, certainly since March and April, and here we are into May, all the information is being distributed. But, it's I think we all, you picked a date in March 1, March 16th, or somewhere in between. But all of a sudden, we all went to work differently, and we're looking. We operate the same way with our members, and making sure that we understand where they're going, and how we can assist them, and again communicate what's really going on as the world changed so drastically in terms of how the consumer was going to, coming into the consumer demands. I mean, it was just that, I think in my area, my point was the biggest focal point. We've all talked about it, but it really started in March. It was totally different. I mean, it became the overriding theme of what was really going on in all our members. Now, again, just to make sure, with NACDS, we have traditional drug, we have mass, and we have food and drugs. Everyone approaches it from a little bit different angle. There's a lot of similarities, but we were essential businesses overall, so we remained open. Our members, and they had to make immediate changes there. And then we saw a lot of demand coming in by the consumer, with the consumer now being forced to shop differently, if you will, in all avenues, excluding, outside of us. So they came to our members, really looking for a lot of services, certainly in health and wellness, but also overall products. So there's a big demand put on that, on everyone.
Well, and that presented a lot of challenges too, right? In terms of not only keeping their employees safe, keeping the customers safe, but staying in stock. And there were certainly many other challenges. How, as they were navigating this, kind of what changes did you see in terms of thought processes, and how did, kind of NACDS support them?
Steve, you want to go first?
Sure. So, we did a couple of things, and we, obviously we saw a lot. But, one of the things we did was we took our, one of our conference websites, and what we did is we made available to our members all the manufacturers by product category. So if you were looking for a hand sanitizer company, and you didn't, your normal source was sold out, you could go online to this directory and quickly search for other vendors in that category. So we were able to, in our little way, repurpose a product to provide immediate need based on what information we had at our hands that maybe we didn't really realize how useful an asset it was. And then we continue to look for new ways to get in front of our members. One of the things, obviously, one of the decisions that Jim had to make was canceling our annual meeting.
Yeah, that had to be hard.
That's not an easy decision for us. It turned out it was an easy, right decision, but that was where we have the changing of the guard. It's where the industry comes together at the senior most levels, you just have to react and respond and do what's right for the members and for for the industry.
I mean, Steve, I would say it's really interesting you bring up that event though, right? Because to me, where, as an analyst, you would have thought, right, these companies never would have spoken to each other, wouldn't have been in the same room with each other. It really served as a platform, I think, for having the drugstore industry and mass but from a drugstore perspective, really collaborate at a different level. And I think we've seen that today, right? I mean, Jim, what do you think?
Well, I think you're right. I think Steve made a good point. I mean, one of the strengths of an association, we believe, one of the strengths of NACDS is this whole issue of relationships. And you have relationships throughout the year, obviously, but in terms of what was going to happen in April, and in terms of top-to-top meetings, strategic meetings, what's going on, all done on a very personal, one-on-one kind of basis is huge. Now, I think the strength about it is because that's been ongoing. We were set up when we went into shelter in place, if you will, and corporate headquarters ceased to exist, and corporate travel ceased to exist, and then you had all the governments and states and what have you prohibiting all sorts of activity. But again, that whole relationship still existed, and I think you couldn't start it; it was there. It just it's taken somewhat of a hybrid form right now. But I think that's hugely important to be able to serve the to serve the consumer right now, and to and the issues of supply chain and shortages and allocations. These are huge issues that impact all your operations, but you're able to have still have important conversations about this in a way, and really not necessarily through NACDS, but because somewhat of what was doing, meetings had been scheduled, appointments had been done. So you went from being in Scottsdale to, okay, we'll get you on Zoom, which no one knew it existed before March, or Microsoft Teams or whatever it was. So not the best, but hopefully not the future either. But it certainly was a way to you had needs out there that had to be discussed, and so let's get to business right now.
No, that makes a lot of sense. If we think about kind of the future and this opportunity to take a pause and rethink the future of the community pharmacy, the future of kind of mass pharmacy, how do you think telehealth, telemedicine, what's the role of clinics? How do we kind of parse through all that?
Well, I'll take a stab at it, and then Steve. I think we come from somewhat the same but different perspectives. I think it's huge. I think it's been telehealth, telemedicine. Getting, using a phone or an iPad to talk to a healthcare professional, whether it be a doctor or a nurse practitioner, certainly a pharmacist, was there. It wasn't new. We had all been talking. There are a lot of companies out of it, but I just think that this whole coronavirus situation has said, we had a technology. People would, can it work? Are we familiar? How's it going to happen? I don't understand technology. All that meant nothing. All of a sudden, we moved forward 5 years in 2 months, if you will, on this. And it's now I would predict that it's now, quote, mainstream. It is not going to go away. It's going to be part of an offering from a retailer. And I think a manufacturer will participate in that. It's hugely important in that it's another way of getting to customers. I mean, everyone's talking about direct to, D2C kind of thing. I mean, this is what better way than having a retailer being able to have on a vehicle or a platform, if you will, It's another word no one knew what it meant until March. But anyways, a platform like this, to be able to talk to someone about their illnesses or their therapy or just their general health and wellness. It works well for our industry. We are in health and wellness, so this telehealth is a huge asset. Steve, you want to add?
Yeah, I think the key is for our members is to be provide the platform through which the consumer accesses the tele part of the conversation, so that we remain a vital resource to the patient / consumer, and then subsequently we have right of first refusal for the prescription or whatever the outcome is provides from the consultation. I think more and more businesses are going to require that a telehealth intervention is the first intervention before going to the doctor, because obviously it's cheaper, it's more efficient, and so I think the employer community will also embrace telehealth in a way they haven't in the past.
If you look at it from a simple customer service or making a difference in people's lives. Here we are, I'm on the East Coast. If I don't feel well and it's 7, 8 o'clock at night, and generally speaking, it would be tough to find someone. Some stores are starting to close, even now with restricted hours, what have you. With telehealth, you're talking to someone in California, it's 5 o'clock out there. They're still working for 2-3 more hours. So the ability to now connect with your retailer of choice, if you will, and to get the kinds of services that you need and to move on it. If you need a prescription, they can do it. They can order it. You can get it, pick it up first thing in the morning. So it's a lot more efficient. And I would say efficiency is one thing, but in terms of improving healthcare is another part of it. It's going to have, I agree with Steve, it's going to be a big role in not only reducing healthcare costs, but making healthcare better for the consumer.
Well, it improves access, right? It's this idea of not only can you basically access it 24/7, but some things you may have been uncomfortable, kind of going to a doctor before. It's completely, I think, changing, so this is changing, right? Healthcare delivery. How do you think we see drug delivery changing?
Well, there's a whole lot of conversation about the last mile across retail, but also in pharmacy, and there's certain regulations that had to change because with a Medicare prescription, you're required to have a signature, and if you're trying to create touchless interaction, we had to go to the FDA or HHS to get them to waive the signature requirement so that there could be touchless delivery, which was one of the big things that one of the things that we were able to accomplish from a government affairs standpoint at the beginning of what was going on. It's fun. We're going everywhere. We're going to the drones. Both CVS and Walgreens have pilots in place. One is here in Virginia, the other is down in Florida at the Villages. And to watch interviews of kids, it's part of their, they think it's their drone. They go to their parents. I saw one interview, the kids going to their parents to say, can we get a drone, delivery? And, that just means they want something from Walgreens, and they love watching it come in, and they fight over who gets to pick up the package. But you're also leveraging drive-throughs in new and unique ways. There's home delivery now. Both CVS and Walgreens that I know for sure are offering it for free with different companies. So I think the objective is to have the product available to the consumer whatever way they want to get it now.
If I can,
go ahead.
No, I was just saying, Steve reached a point with all the various ways of delivery, drone to, home delivery to pick up, curbside, contactless at the drive-in. It's interesting. We mentioned the big guys. I'd be remiss if I didn't suggest, we have regional players or, some of the smaller operators who, not drones per se, but delivery and pickup, have been, mainstays of their business. It's been a differentiation that they've used to, in terms of compete in their marketplace. So it's been interesting. They've, continued to expand it. They were ready to go. And now, other people are seeing how it can be, like anything else. When you have thousands of stores, it's a little bit more tougher to get a policy together than if you only got 100 stores. So it makes some sense, but I think it just goes to show that, right now the importance was making sure that, the health and wellness of our customers was at its peak. So all these things now, you took a look at it and said, we can actually have a pickup of it. We can do it to have a delivery. They don't necessarily have to always come in, especially if they're in isolation at home. You don't want them in the stores. They can't come in. So, you don't want to lose them for 2 weeks. Let us find a way to get to them. But not everyone's got a caregiver, so we can drop it off at their home and they can, contactless pickup. It's great. It works well.
How do you see, product mix changing? We're hearing about more fresh food in, community pharmacy because it's easily accessible, and a lot of what you discussed in terms of, quick delivery and new pickup options. How do you think beyond, let's say, fresh food, what other categories around health and wellness might we see in the future of the, kind of drugstore?
I'll take a stab. I think it sort of depends a little bit. There are those, the clinics and things like that we talked about earlier are huge. They're just a natural extension of where you are and what your brand is. And it makes a lot of sense. You can do that on your own, like some companies are doing, or you can do it with a third party to provide it. And they both make sense. I think anything that's, we're looking at and moving forward with vaccines and immunizations are going to become just a lot more prevalent. And I think a pharmacy is going to have a huge role there. We alluded there's some regulatory obstacles and things like that, but I think it's known if you're going to have a program from a health perspective, including pharmacy, and it makes it, it gives you 42,000 outlets right away that can provide it. That's, it's hugely important in terms of providing immunizations and vaccines out there. I think you're going to take a look at other kinds of partnerships you alluded to with food and other kinds of services that you're going to see on the delivery part of it. We haven't even talked about driverless cars and things like that. It hasn't really entered into it. But when you think about it, it's a huge natural, not only for pharmacy, but also for the other items in the store, all the CPG products and things like that. But you can now go and it makes a lot of sense. You're just going to, I think, how the consumer shops is going to change. I think some of the change that we've seen is going to be, not all of it's going to be permanent, but a lot of it's going to be permanent. And it's going to be interesting. We always just think that the millennials were driving it, and the boomers were more hesitant to adopt. I think you've seen now the last 2 weeks that everyone's adopted.
Yeah, and I guess I'd add to that, Deb, is, one of my favorite stories was the blackout in New York City years back, and the stores were looted. And I remember the Macy's CEO telling his merchants, go look at what was stolen. That's what we should carry. So my guess is that the CEOs in our industry right now are telling their merchants, and again, this would be pre-vaccine, because I think they're planning for two futures, pre-vaccine and post-vaccine. Yeah. So if we do get the next wave, or when we do, if the vaccine hasn't arrived, my guess is the CEOs are telling their merchants to identify what was sold in bulk and make sure you have quantity on hand.
Selection in health, you take a look at some of the items, disinfectants, antibacterial products, if you will, paper products and things, just to name a few. I think people are going to look at the numbers and say, okay, is that, do we, do we take a look at reemphasizing and making, moving in this direction? Are people going to be focusing on health and wellness now for the rest of their, moving forward? So is this an area, an opportunity for us to really make it, make a difference? And again, with delivery, you can actually now package these things a lot differently than you could before. I think people will be looking at how these real lasting changes out there. I think that many of them are. So I think it's going to be. I think it's our members. It's going to be interesting working with the suppliers. There's going to be some great innovation coming forward and new ways of doing business.
So you talk about new ways of doing business. I mean, one of the things as a drugstore analyst, I was always shocked was just kind of how low the compliance rate was from a consumer perspective around, kind of taking the drugs on the schedule that they were supposed to, and how that really impacted their health. Do you see some of the technology that's coming out, or processes and procedures, and if it's the pharmacist relationship with the customer, how can that change?
Well, I'll start. I mean, I think there is. I mean, apps have become, mainstay now, and I think people are now going to look at it. And I think there's issues of privacy. Let's be honest. I mean, with everything, but putting that aside for a minute, I would say I look at, myself, for example, probably today, I'm probably a lot more receptive to the idea to having, managing my healthcare in conjunction with an app, if you will, maybe with the pharmacy that I go to or my doctor, if we can sync them, so they can remind me to take, if I'm on a maintenance drug, they can remind you to take it every morning. There's a text or what have you. There's a reminder that you need to refill. Those kinds of things used to be somewhat of an annoyance. Now I think people are saying, you know what, they're not an annoyance anymore. They're needed. So I think that there's and with digital health and what have you, so I think there's a huge opportunity to make a difference. Now it's got to be easy, and it's got to be protected, and the other kinds of things that need to be done. And obviously, it's if you call someone up, you hope that, I mean, how many, it's like the same thing we do with a cable company. You call you up, and it's like, they have all this information. They keep asking you the same thing for it all the time. I mean, so we don't want to go down that path. But if it's relevant and it can be useful, I think it makes a lot of sense, and it's going to improve health. Steve? Yes.
One of the things that I've heard a couple of our people talk about is how few visits were made to the doctor for other indications. I think we're going to have, other than COVID, whether it's first time people getting prescriptions for high blood pressure because their stress level has risen because of what's going on. I think there's going to be a huge catch up in the medical profession starting in a couple of weeks, and it will allow us to enroll more and more people into these types of programs. And I think, to Jim's point, they're going to be much more receptive, because I think health and hygiene are going to be, two of the big themes going forward for the next couple of years.
I mean, it was tough. I'll look at all the medical offices that were shut down. I mean, the ones that actually provide in our industry prescriptions. You're going in for dental care, you get a prescription. You're going into any type of general practitioner or whatever it may be, a dermatologist, name an orthopedic. I mean, they're generally involving certain, coming some way into our stores for various products. All that sort of, when those offices shut, you lost those customers. So, to Steve's point, with the shelter-in-place orders now ending pretty much, well, across the board, come June 1, if you will, pick a date, that they're going to be, a lot of those people are going to start getting caught up on those. It's interesting when a lot of those offices, as an aside, sort of probably like many of us, we got emails saying, if you need some, we'll do it. They went virtual.
Right.
So now they're sending you back another email saying, we're now open if you'd like, and there's social distancing, and you're going to have to call and, wear a mask and stay. We're not going to allow any more than one or two people, all those kinds of things. But they're also at the bottom, they're also keeping the telemedicine option alive and things. So I think they even see there's a reason to keep this, provide a greater service to people. I mean, you just think you travel and stuff like that, you get sick. Now you can, call your doctor back home. I mean, none of us would have ever thought of doing. I mean, you try and get them on the phone, but now you get them on, on your iPhone. It's different.
Yeah, no, it really is. So one last question before we review the poll results is, what do you see as the role of community pharmacy from a COVID testing perspective, or will it be more about vaccine delivery? If we can look out into the future, how do you think the opportunity is for them to serve some significant needs of the consumer now and in the future?
Well, yeah, I'll take Steve. You want to go first? I'll go. Either way.
I think setting up the testing now is really preparing us for the second wave, because what we'll be able to do is have those tests, more sites available faster, get the results faster, be able to do the contact tracing. So we'll be talking about a hotspot rather than a nationwide event. We'll be able to react and respond really quickly going forward. And I think that's the real benefit of opening them up now, because we're saying, geez, we're X% the way through this one, but I think it's really enabling us to be ready to react much and respond much better next time.
I can add to it. I mean, again, I think most of it's all looking at is pre-vaccine and post-vaccine. And if you're looking at it pre-vaccine right now, I mean, the testing, there's more testings needed. And again, I go back, there's the testing for the actual COVID, and then there's the testing for the antibodies, two different animals going on right now. For the actual, we have, there's, and testing is needed for both. But when you think about it, first you got the actual testing for COVID is a little bit more reliable than the antibodies at the moment. So people are looking at it, and the more sites that are open up, the more people are getting tested. But it's just one phase. To Steve's point, you're still, if you come in negative, that's all great, but do you have the antibodies, which it doesn't say you want to know, and that's in terms of getting the country back to full opening. But I do think, to the point, it's a two-phase. Testing's critical, but it's also going to lead when we do have a vaccine, whenever it may be, that's when you're going to see the entire industry really, because based upon the things we talked about, Steve mentioned with HHS and what's happening right now to allow it testing and immunizations in all 50 states is going to be huge. I mean, if you go back to the days when other vaccines, the biggest one was way back when polio came out. I mean, everyone had to get it. So how's that going to happen? I mean, you can't just have. So I think pharmacy will be a huge player in the process of administering the vaccine.
All right, so let's review our poll results. As a brand or retailer, have you implemented processes to begin digitizing your supply chain? 100% said no. Which goes back to some of the conversations we've had in terms of the opportunity for the industry. But this is the positive. If you have not begun to digitize your supply chain, do you plan to? Yes. And, I think we heard from Alec Orley yesterday at Walgreens, who said, right, I loved it, right? This idea of kind of 10 years of innovation in 10 weeks. I mean, we're seeing an industry that's become incredibly innovative on all aspects of the consumer. And that's a real challenge. And so I would say it's exceeded even like my wildest expectations. And then this is also really interesting, and maybe goes that we should have offered more options. But if you are a retailer, which method of pickup are you seeing used by customers most frequently? BOPUS, curbside, and drive-through were not. It said none of the above. And I'm wondering, right, there are other ways that we are seeing kind of delivery, because we didn't talk about delivery to the home. This idea of, so I think that we are seeing kind of in terms of new ways of some of these retailers looking at pickup, or if we're thinking about, kind of how people are looking at getting product delivered, if there's still a reticence in terms of, kind of going to physical stores, they are looking at new methods. When we talked about drones earlier, which is, kind of really quite exciting.
Well, see, there's home delivery. I mean, a lot of people have been doing home delivery. I will say, I don't have a feel for how much of a store sales it is, but it's definitely been a big, especially with the shelters and places. I mean, home delivery has been a huge asset.
Yeah, no, it truly has. We have many questions. So for those of you who have not yet asked, please use the Q&A function at the bottom of your screen, and we will kind of jump in. So what kinds of drugstore retailers do you think have the greatest opportunities to work with their customers and collaborate going forward?
Well, what kind? All of them do. I mean,
I think maybe size is what they're asking.
I'm sorry?
Maybe size or regional or, national.
I think it's both. I mean, I think regionals are a lot closer, so they have certain advantages that I think they realize they've known and they're leveraging. I think nationals have understood that this is an area that they have great opportunity to put a lot more, to make a difference with their customers. So, I mean, as an association, we're going to play, unfortunately, unlike Solomon, we can't split the baby in half. So we see opportunities for all our members.
Yeah, and I think one of the things that maybe the larger chains have figured out through this is their local people are really talented, and maybe they just need to listen a little bit better and a little more. So I think there's recognition that there are really good people in this industry, and they don't all live in headquarters. In fact, you're starting to hear, the senior executives say they don't work in a headquarter, they work in the support center, which is really kind of flipping that, command control mentality that has been in retail, kind of flipped it upside down, which is really interesting to see.
Steve, you bring up something incredibly important. I spoke to a CEO yesterday, and he said, we've always had titles. We're going to go away from those titles just to responsibilities. And you talk about, right, if you think about what this inverted triangle might look like, right, who's there for whom, and quote unquote, who's really like on the front lines, it's really changed. So it's a very important point. All right, how much less drug can a drugstore become before it's just a convenience discount store? Is something like telemedicine the answer?
I mean, the average, less drug. I think drugs are always going to play a big part. Pharmaceuticals are always going to play a big part. I think I look at it a little bit differently. Right now, in many of them, that the pharmacy is the greatest percentage of the store sales and things. Probably maybe potentially a rebalancing, if you will, based upon what the consumer's demanding now or needs are. So I think I see it as not going into a convenience store at all. I mean, but to a rebalancing of it and emphasizing the categories in terms of the holistic approach to who their consumer is. So I think I look at it, the great opportunities there.
Well, the rebalancing could also help with margins significantly too, because the front of the house tends to have better margins than the back.
Yeah, I mean,
it's a great point.
Margins are tough. There's no doubt about it. And so I think that, but I think, yeah, I mean, it's still an integral part of who all our members are.
Well, I think it's really interesting. I've always loved this idea of kind of community pharmacy, because I do think that oftentimes, right, the pharmacies are the heart and soul of the neighborhood. And I feel like the role, right, was again, because they're essential retail, consumers may feel, they need to come in for many necessities. But I feel like the role of the pharmacy drugstore in the future will evolve, and especially kind of community pharmacy. I don't know, Steve, what do you think?
Yeah, I think that as we've gone through this, pandemic, I think the consumer kind of is reminded of the drugstore when we grew up, and it was the guy, it was Doc, and knew everybody's name and was approachable and relatable, and I think we're seeing that kind of come back. I think we're trying to leverage as many of our assets as we can in the stores, and I think that the pharmacist is just an unused or not unused, but could be used more effectively for the community.
Yeah, definitely underutilized. All right. That's a great question and very practical. What are best practices for shopping safely, operational considerations, and designing for social distancing?
Well, I would point the best resource I've seen is Kroger created a playbook that they published for the industry. So I would go to Kroger.com/playbook, and it has some great, lessons to be learned. There was also, and it's up on our site, IGA China came out with a best practices manual that they used in China that they've brought back to the United States. And so there's, you know, you see some great innovation going on. There's something that was on Twitter earlier this week where they were talking about, it was a Sam's Club. They've been told by management to try to touch less as employees. So this one department manager, just, you know, everyone's got in their pocket an override key, or not a key, but a barcode. So he made the barcode as a wristband. So now the guy just goes in and all the store has done it now, and they're broadening it out to all the Sam's. You just scan the wristband, so there's no touching, and the cashier plugs in the override code because he's being overseen by the manager. So, you know, everybody knows what the code is, but you're just getting that many fewer touches within a box. And so I think there's all sorts of things that people are learning and sharing individually, and there, you know, there's going to be a new playbook that's written.
Yeah.
And all those kinds of ideas are being funneled up.
I mean, there's definitely a new playbook, but some of the basics. I mean, they're sitting on the 6 feet distance in the store, wearing masks for whether you're going to require customers to wear them or not. And there are variations in all the states about how you can even enforce that and what's going on. Retail for the traditional, many of the drugstores are requiring masks but not enforcing it. Pharmacists are wearing masks. You have the issues of, in certain instances, the protective equipment that's needed that's there. But I think to a point, there's going to be the guidelines, as Steve alluded to, the playbooks, if you will, from various companies, and then the Centers for Disease Control has fairly, good basic guidelines out there that you got to comply with no matter who you are. And that's going to be, they're doing it for a lot of industries, but health and wellness is in pharmacy. They've pretty much, they've been out there since March on what's really required or not.
Well, I think something that, many consumers probably don't appreciate is, right, the cost that has been added to operations. And so not only is some of it around hazard pay, but we've talked to many retailers, right? Even putting up kind of the sneeze guards, et cetera. I mean, so there's an expense, but there's also, employees also have a certain fear level. What have you heard as you've spoken to your members about how they're, kind of handling that and like the mental health of their employees? I mean, these people, right? There are different types of frontline workers, but these folks in pharmacy are truly on the front line.
Well, you mentioned the barriers. I was probably remiss. I can remember many of our food members put those in, were one of the first to put them up. And so they're, on the national news and all that. I mean, you're addressing the concerns of employees with, with all the relevant, information that you can have. And I think that, it's changed. It was such a fast moving area, how it's transmitted. And today, everyone's been wiping off all their packages they get at home now and their groceries. Today, the CDC basically say you don't you don't have to do that anymore. So you got to feel how comfortable you are right now. But I know a lot of the employers have, whether with their employment policies, their leave policies, their counseling policies, and all geared to understanding the consumer. I mean, their employees are critical to their success. They're first and foremost. So you got a lot of, there's concerns, whether it be at the store level or the distribution center level on what's going on. Because when you think about it, they're on the front lines. Many of the executives, are like us working from home. It's a different concern. So you had to be sensitive to what it was and to the actual needs of all the people. So I think every CEO would tell you, hey, a lot more emphasis by, if you will, the HR people on our employees' well-being, because if they're well, then our customers will be well.
Yeah, no, that's an excellent point.
Yeah,
right,
and then you're also seeing a lot of, like, Wakefern built a website to allow customers to thank their store level employees, and for every customer that writes on the website, Wakefern will donate to charity. So I mean, you're seeing all sorts of types of ways that people are trying to reward and recognize the store level people. What's been going on with graduations is great. I watched last night HEB had a huge celebration online for all the Texas graduates, and they highlighted their store level employees that were graduating. So in today's time, you've got to find reasons to celebrate and make sure that people understand that they're respected and appreciated.
Yeah, and if I can just, one last point, and it goes back to, I think we alluded to the community. The stores are really integral parts of the community. So I mean, it goes back with having your employees are integral part of the communities. It just it's good business sense.
Well, you bring up a really important point, and it's something I've felt throughout my career, is that there's so much good that, whether it's, supermarkets or drugstores or mass merchants, that they do for the community, but it's not necessarily, they don't, I think, kind of beat on their chest enough in terms of what they're doing. And, whether it's, kind of sponsoring races or, kind of sponsoring well visits. And I do think this is an opportunity for the industry to not only celebrate their employees, celebrate what they do. And I don't think that they should be, should hold back, because I think that we all need something really positive to focus on. So to me, it's almost giving them more permission to say, what have they already been doing? But what are they doing that's different for their employees? I don't, is it the industry that they want to, I mean, they're very humble, but how can they use this time just to, once again, it's the idea of being inspirational.
Yeah, I mean, NACDS produced a PS. It was a commercial that turned into a PSA that ran for a period of weeks, that was designed right to that point about the historic role of pharmacies in America's times of greatest needs, and it's a terrific celebration of why Jim and I have combined worked for NACDS for 75, 76 years. So,
wow. No, but I think, on those things, I think you take a look at it. You're right. I mean, I think there are, all the members are now going to take a look at this thing, and not to be self-serving about, look how great we were, but we really, they're going to thank their employees for, going the extra mile, if you will, during being on the front lines of this issue. I mean, you have back to school, if you will, coming and using, I mean, not so much using that as an opportunity to thank people. I mean, we're going to see how the whole opening has gone. I think, NACDS has we sent out a white paper, last week on the reopening of pharmacies, a vital partner in the reopening of America. So, I mean, there's lots going on right now to say, you got to, it's one, toot your horn, but there's a reason you're tooting your horn.
Yeah.
If you will. There's been some good things done, I think, and it goes back that our industry's really been we've been in health and wellness as part of what we do. Much of what we do has been no better than the last 10 weeks to really show how that, that role of being there, and, using that in your communities and leveraging it and getting everyone to say, we're all in this together. When we've survived, and we're going to go forward, and but there's lots of things that go all the way around, to our customers for being understanding, and to our employees, for stepping up.
I'm gonna close this out on a fairly detailed question, but what are important technical capabilities needed to have good telehealth experience for complete evaluation of health, and what do you see as the future of telehealth?
Well, I think I see it as certainly a good future that is going to continue to grow, and how it grows, and as it's going to be important. I think the features are going to be, one is convincing the consumer to give more information to it.
Yeah.
I mean, it can only be as good as a diagnosis can only be as good as the information you get to give a diagnosis. So if you're not conveying half the material, it's going to be tough. And the more you convey, the better the diagnosis, and the better the conversations get, the more people are going to use it. So I think, and it's, again, the record keeping, privacy, all the kinds of things that go into it, access to your medical records, your prescription therapy, Yes, we all been in doctor's offices. You check in, they ask you what prescriptions you're on. You go, they put you in a room, they ask you what prescriptions you're on. The nurse comes in, they ask you what prescription. The doctor comes in and asks you what prescription. I said, like, what? How? You know, what are you going to do with all the stuff I tell you about? Where did it all go? So, I mean, having those records all makes sense. So it can, you know, it can work. I think, and every system's differently. And again, unfortunately, you got 50 state laws and, or, you know, all the privacy issues that go on about it there. And because the doctor is not going to probably be in your hometown, it's going to be, they're going to be elsewhere. So you're going to have to deal with all that. But it's just, it makes tremendous sense.
Yeah, and as people become more concerned about their health and they start utilizing things like wearables, like a Fitbit or an Apple Watch, which can monitor things over time, and that gets synced into a telehealth visit, then the doctor's going to have a lot more information than, you know, whether or not you self-took your blood pressure and did it wrong,
Right.
and you know, think your blood pressure's managed, and you know it's actually skyrocketing. You know, so I think wearables will have an impact as consumers become comfortable that the people that are supposed to have the information are the only ones that have it, and it's not locked away and being sold 50 different ways by some technology company to maximize revenue versus optimize health.
And the operational too, is going to be like anyone who goes online now to purchase something. If it's, you know, thorough, if it's easy, I mean, it works first time, you know, it makes sense. You can, you know, you can go click here, you get to where you got to go, and you can start making decisions, and you get confirmation, and you get all your record and what have you. Then it works. If it's not thought about as a process to, you know, people want to have clarity all through in every step. If it's not there, it's not going to work real well. So, you know, the systems are there, and they'll be revised and they'll move forward. But it's definitely going to be, you know, we could come back in a couple of years, and the question was, why did it take so long to become standard?
Exactly. Well, thank you guys so much. This was incredibly insightful. We appreciate your time and look forward to talking to you soon.
Hey,
Thanks for having us.
Thanks. Bye-bye.
Bye-bye.
Bye, everyone who was on. Hope you enjoyed.